Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford IceHogs. Let's dive into it. Hello, and welcome to another edition of Ask the Chiropractor. Thank you for tuning in again. Where I live in northern Illinois, this week we had our first little bit of snow. Now it's going to heat up, it's going to go away, and it's going to give us a chance to catch up on some of those yard projects that maybe we didn't have done. I know I have a couple flowers that still need to be cut down, a couple bushes that need to be trimmed up, and lots of leaves that still need to be raked, even though we did our best before the snow came. But this is usually the time of year where people start asking me, how do I prevent back injuries with the snow? I understand that people hurt their backs, they go to a chiropractor during the winter months. What could I do to prevent? Let's talk about some of the obvious things first, and let's dive more into the chiropractic part afterwards. Before you ever do a physical activity, you should always warm up first. When I go to the gym, I'll walk a little bit, I'll move around a little bit, I'll roll on a roller a little bit and warm my muscles up. Then I'll start a stretch. So let's talk about how this would apply before I went outside and shoveled snow. One way you can warm up is going for a walk, like I said. Walk around, take a look at the driveway, see what you're going to do. Walk around, wake those muscles up. Another warm-up that I like a lot is when you take a shovel and you put it behind your back and hook it with your elbows. So it's behind your spine, but your elbows are hooking it. And then take that and gently turn to the left, turn to the right, turn to the left, turn to the right, and do that about 10 or 12 times. That'll warm up the disc in your spine. You see, your discs are like your shock absorbers, and their job is to help maintain the gap between the two vertebrae so the nerve come out happy. Now, the good news, if you lean left, they'll all bulge to the right, and if you lean to the right, they all bulge to the left. Discs are designed to bulge, they're designed to move around in order to keep you good. So before you stress them, it's good to warm them up. And by doing that little twist, that simple little twist, you'll do it. Now, I'm not saying jerk. I'm not saying turn fast. I'm not saying be aggressive with it. Just nice, gentle glide side to side. One of the tricks I use is I try to find something to look at each way. So this way I make sure I make a full turn in each direction. Now, as far as stretching is concerned, you're going to be doing a lot of twisting and turning. So stretching your hip flexors, stretching your piriformis muscle, and some of your overall hip area is a great idea. And also warm up your shoulders to get your shoulders stretched. Many of you have heard me say many times, retract your chin, squeeze your shoulder blades together and count to 10. That's a great stretch to be working on. You can also go up against the wall, have your hips, your heels, your shoulder blades, and your head all touch the wall. Put your hands up like someone's robbing you, and then slide your hands up and down the wall while everything maintains its touching 10 times. That's a great stretch and warm up for your shoulder area. You could probably go online and find thousands of different sites about exercising and warm-ups before you shovel. Whether it's a physical therapy, whether it's some chiropractor website, there's all kinds of them out there. But yet people continue to have back problems. What's going on is there's a big underlying condition in your spine. It's not a matter of warming up. It's not a matter of stretching. It's the fact that your back needs some chiropractic care. You got misalignments in your spine. And the pain is a message telling you there's something wrong, not to be ignored, something that needs to be corrected. And chiropractors are uniquely trained to help find these spots and give them chiropractic adjustments and help them. So if you're somebody who every winter deals with lower back pain, shoulder pain, every time you go outside and shovel your snow, it's probably not from a lack of exercises or stretches. It's probably not from a lack of warm-ups. There's probably bigger things going on that you've just been ignoring, like going to the chiropractor. So this week, it snowed over the weekend. I came out of the hockey game. I'm the team chiropractor for hockey team. I came out and I found snow all over my car. Brushed off, went home, and I put my snow scraper in my car for future. I wasn't prepared this time. And I had the opportunity this week to get more prepared because it's going to go up to the 55 degrees this weekend. Why don't you use that opportunity to do the same for your spine? We had a little snowfall. It didn't really get on the cars, on the streets too bad. It just got a little bit in the cars on the grass. But now it's going to warm up. So if you're someone who chronically has lower back pain, this would be a great time to go to the chiropractor and start working on your back. So that way, as your stress goes up and the shoveling starts to increase, you'll be more prepared. Preparedness is the best way for prevention. So what should you expect? You call the chiropractor up and tell them that you chronically have lower back issues every time you shovel snow. Chiropractor will get you it. They'll have you fill out a complete health history, because in Illinois, we're primary healthcare providers. We're chiropractic physicians. And so you fill the same health history you would anywhere else. Then you'll meet with the chiropractor. Now, the chiropractor will probably do a chiropractic exam on you, have you twist, turn, lift this leg, move this leg, bend these knees, turn your head this way, turn your head that way, whatever the exam the chiropractor uses in order to help find misalignments in your spine. In my clinic, we usually also follow up with chiropractic x-rays. Chiropractic x-rays are the best way for us to know what's going on with your spine. Now, if you've had spinal x-rays somewhere else, bring them with you, because x-rays of your neck are x-rays of your neck. It doesn't matter who takes them. But it does matter who analyzes them. Chiropractors and your medical doctors, they have radiologists that read your x-rays. Chiropractors, for the most part, we read our own. And we look for tumors and fractures, misalignments, maybe gross problems as far as your spine lines up, how it twists and turns. But chiropractors do a deeper dive into and also really analyze the alignment. Now, there might be some little alignment notes on your x-rays, but nothing like a chiropractor is going to look at. We're going to look at each individual segment compared to the segments above and below, and really try to get to the heart of where the misalignment is, that we can help make the corrections. Maybe even told you have a scoliosis. I got to x-ray a patient this week. She's grew up her entire life, though she had a really bad scoliosis. Many people in her family did. But when I did the chiropractic x-rays, I was happy to tell you she had no scoliosis. Her spine was almost textbook perfect. So let a chiropractor tell you more or less what you have misalignments. So after you have your x-rays and after you have your chiropractic exam and you fill out your history, the chiropractic should start chiropractic care with you with a chiropractic adjustment. Now, in my office, we give you the chiropractic adjustments the first day. Not everyone does that, but that's how we do it. That's how we choose to do it. You get your chiropractic adjustment, and then within the next couple of visits, you'll come in and we'll give you a game plan or care plan, what we think it's going to take to make these corrections for you. Now, the good news is if you go into the chiropractor and you're not having back pain right now, you're having less symptoms and more symptoms, it's going to require less visits. So if you've been hesitant to go to the chiropractor because you're afraid of how many times you'll have to go initially, if you go in when you're asymptomatic, when there's no inflammation or pain, it's going to require less time to correct you, because we won't have to get over the inflammation stage because you're not in the inflammation stage. If you just say, I'm going to wait to go till I'm really bad, you're going to end up going more than if you just went in when you're not asymptomatic. So going in asymptomatic requires less visits than going in when you're acute, meaning that you're in lots of pain. I've had people carried into my office. I've been phone called to go outside and help carry people in. I've had to help prop people up for their x-rays because they're in so much pain and they were scared to come in because they didn't want to have to come in a lot because they waited so long to come in. Now they have to come in a lot because it's going to take 2 or 3 visits even before we can get you this laying at the table in order to do the real adjustment we want to do because you're in so much pain and you're so acute. So being in a day when you're having no inflammation, no pain, your range of motion seems pretty good, that's a fantastic day to start chiropractic care because you're going to give yourself a head start. Remember, it's always easier to stay well than it is to get well. So when you go in, when you feel like you're well, and the chiropractor can get a head start and get you to your care plan that much faster. Now, when you start a care plan in my office, we'll start you off at a higher frequency. Then we'll decrease the frequency and we'll usually introduce some homework for you, some stretches. Then once we know that you and the stretches get along, we'll decrease the frequency. And then we'll give you some at-home stabilization exercises. A lot of people have looked online to find exercises to make their back stronger. You've maybe heard me talk before in my various podcasts about stabilization muscles. When I went to school, we learned about cardiac muscles on your heart, smooth muscles in your artery, and all the rest were called skeletal muscles. It turns out if you take a microscope and look at the muscles around your spine compared to the other skeletal muscles, they look very different under a microscope. Inside your arms and legs, you have a thing called Golgi tendon organs, and your brain can consciously tell a Golgi tendon organ where to go. So if I want to raise my left hand, the nerves come down my neck to the brachial plexus into my shoulder, down my arm, and the arm goes up and down. Now it's working. My Golgi tendon organs are moving. But if I want to move the fifth bone of my neck, I can't. Now, not a chiropractor. because those muscles don't behave the same way. They don't have the Golgi tendon organs or GTOs. Instead, these muscles are innervated almost 200 times more than any other muscle in your body, meaning you have 273 neural connections per square millimeter versus 70 in your TMJ, which is the next highest one. So these muscles' job is to keep your spine always upright and keep your eyes always level. They're very reflexatory neurological muscles. So if you go online and look for the exercises and the warm-ups and the cool-downs for shoveling, you might be surprised that a lot of these exercises aren't going to make you stronger. Maybe you've worked a ton of stuff over the years with various healthcare providers or maybe physical therapists or a strength coach that told you they could help strengthen your back, but yet you continue to have issues. When you start introducing stabilization exercises and you start making your stabilization muscles stronger, that's when we really see people start to hold their adjustments and make big changes in their spine. So we'll eventually introduce stabilization exercises into your care plan. It might be as simple as standing on one foot. It might be a lot more complicated than that. So that's what you should expect. So if you're somebody who's worrying about the snow coming, not because you're scared of driving, not because you don't want to go out cold, but because you know the amount of aches and pains you're going to get from shoveling the snow, the time to act on it is now, not when it's already too late. And remember, the ice hog players, the basketball players I've worked on, the college athletes we work with, and any other athlete we do, they get adjusted before the competition, not after the competition's already begun. They don't wait till after the game they hurt really bad. They come see me. They come see me before. When I took care of the strongman games, they came to see me before they hurt, not after the pain was bad. So why is it that we had the same concept when people go to the chiropractor now? I hear a lot of people come in and say, I was going to get adjusted on Monday, but I saw there was a big snowfall coming Monday, so I thought I'd wait till Wednesday to come see you in case I hurt my back. And that's fine. You're going to see me Wednesday, Thursday, Friday, probably Monday. If you would just kept your Monday appointment, you would have saw me the one time, and we would have been able to help you not get hurt rather than get hurt and then try to fix you afterwards. So if you experience lower back pain years after shoveling snow and doing all those things, the time to get adjusted is now. The time to get seen is now, not after it hurts. Thank you for tuning in. I hope this helps somebody. And remember, if you have questions about chiropractic or chiropractic care, there's only one person that's qualified to answer that question, and that would be a licensed practicing chiropractor. Nobody else has studied chiropractic. I would never ask my dentist questions about my ingrown toenails because it's not part of their education. And chiropractic is not part of the education of your family doctor, your physical therapist, or an orthopedic doctor. There's no chiropractic classes for them. They don't know what we do. So if you have a question that I can answer, go ahead and leave a comment below wherever you're watching or listening to this, and maybe next week it'll be the question of the week. Thanks, everybody.